I was very honored to receive and to accept the offer to chair the Musculoskeletal Department at the Hudson Regional Hospital in Secaucus, New Jersey. I'm the president, founder, and chief executive officer of the Kayal Orthopaedic Center. The Kayal Orthopaedic Center is a multi-specialty orthopedic practice focused on primarily treating musculoskeletal injuries. So we're proud to be associated with Hudson Regional Hospital. We're proud to offer the latest and greatest technologies. But one of the things we're most excited with our new relationship with the Hudson Regional Hospital is this Institute for Robotic Surgery. It's minimally invasive surgery using the most cutting-edge technologies, improve the outcomes, improve the patient experience. The area of orthopedics is an area where doctors in general are the most technologically innovative. When you're knowledgeable about the advances in medicine and you remain current in the area of orthopedic surgery and biological therapies and different technologies are being offered, you can be the best physician. In the area of knee replacement surgery, we've introduced the concept of Mako robotic-assisted surgery. We're introducing two technologies simultaneously. The minimally invasive direct anterior approach for hip replacement surgery combined with the technological advances using the Mako robotic-assisted arm, which ensures the accurate sizing, placement, and alignment of all the implants. The surgical technicians at Hudson Regional Hospital, they've been very open to receiving new technology and training for that new technology. We've been very satisfied with the white glove service offered by the Hudson Regional Hospital. It's a smaller community hospital which allows for such personalized care, individualized care, and that's something that's lost sometimes in the bigger systems. Now we are proud to announce that we are delivering the latest and greatest technologies in the area of orthopedic surgery at the Hudson Regional Hospital in Secaucus, New Jersey.